Good day, Ma'am Kasilang. I am Makisha Dennis Espolino from DSM-1F3, and I am here to demonstrate my return demonstration for Tepid Sponge Bath. So first, what is Tepid Sponge Bath? So this is a procedure where the patient's body is not immersed in water, but it is wiped with a cloth that is soaked in tepid water. So tepid water is made up of two parts. One part of cold water and one part boiling water, which produces a temperature of about 40 degrees Celsius or about 105 degree Fahrenheit. While for fever reduction, cooler water of about 24 to 33 degrees Celsius or about 75 to 92 degree Fahrenheit may be used. So this procedure helps to lower the body temperature, maintains cleanliness, and it also promotes comfort. So now for the assessment, I will first assess my patient's general condition to ensure that it is safe to start the bath. So ma'am, how are you feeling today?
I'm a bit under the weather.
So ma'am, I am here to help you to lower your temperature so that you will feel more comfortable soon.
Okay po.
So next is to assess the patient's ability to assist in the bathing procedure and ask for any hygiene preferences. So ma'am, can you move both of your arms and your legs?
Yes po.
Do you have any hygiene preferences that you want to be followed?
None po.
Okay ma'am, noted. Next is to remind the patient to call for help when getting up. So this ensures that the patient's safety and prevents any falls or injury during the procedure. So ma'am, please let me know if you need any help or assistance or you want to get up during the bathing procedure, okay?
Okay po.
So next is to assess for any presence of tubes or external medical devices that is attached on the patient, such as the IV lines, the oxygen tubing. So this will prevent any future accidental dislodgement during the bathing procedure. So as you can see, my patient does not have any medical devices attached on her. And lastly, for the assessment is to observe the patient's temperature and review the doctor's order. So this ensures that the bath is appropriate and safe for the patient's condition. So ma'am, I will be checking your temperature. Is that okay with you?
Opo.
So now for the planning is to first gather all of the necessary equipments to the bedside. So this will prevent any interruption during the procedure. So as you can see, I have already prepared all of the necessary equipments that I will be using for the tepid sponge bath. So next is to plan the duration of bath, which usually lasts for about 20 to 30 minutes. So planning the duration ensures that the bath effectively reduces the temperature of the patient. So after that is to plan the continuous temperature monitoring to prevent the patient from becoming too cold or too warm. So ma'am, I will be monitoring your temperature regularly. Is that okay with you?
Yes po.
So now I will provide privacy for my patient to protect the patient's dignity and also to promote her comfort. So as you can see, I have already closed the curtain and I have already closed my room's door earlier. So the last is to adjust the bed to a comfortable working height, which I have already done. So this will prevent back strain for the nurse and it will also provide safety for both the nurse and the patient. Now, I will be moving on for the implementation. So first, I will introduce myself to the client, identify the patient, and explain the procedure. So the correct identification prevents any errors and it will also ensure the patient's safety. So while explaining the procedure reduces the anxiety of the patient and it will also promote cooperation. So, good morning, ma'am. I am Akisha Denise Espolino, and I will be your student nurse for today. So, may I please confirm your name and your birth date?
I am Fatima Rose P. Mendoza, September 21, 2007.
So, I am here to help you assist by cooling down your fever. So, I will be gently wiping your body using a tepid water. So please let me know if you feel too cold or if you feel uncomfortable during the procedure, and I will assist or do an action right away.
Okay.
So next, I will provide privacy to my patient by closing the windows and curtains, which I have already done. And next, I will perform hand hygiene, which I have also already done. And I will wear gloves. So this will prevent the transmission of the microorganism and the spread of the infection. So now, I will follow standard precautions if in contact with blood or body fluids to protect both the nurse and the patient from contamination or infection. Next, I will cover the patient with bath blanket and I will remove the gown. So this will maintain privacy and warmth while exposing only the part that is being bathed. So I will position the bath blanket on the middle of the patient, and I will ask her to hold the top part while I will pull down the bath blanket. So ma'am, can you please hold the top part?
Yes.
So ma'am, do you need any assistance with removing your gown?
No.
Okay. Thank you, ma'am. So next, I will keep the bath blanket over the areas that is not being sponged. So I will only expose the area that I will be sponging and keep the rest covered. So next is I will place a rubber sheet under the patient's back or a bed protector under it. So since I do not have any rubber sheet, I will be using this towel instead as my alternative. So ma'am, I will position you on your side since I will be putting a rubber sheet under your back. Is that okay with you?
Okay.
Can you move this back?
Yes.
So now I will check the water temperature using a bath thermometer. But since I do not have a bath thermometer, I will be using this as an alternative. So checking the water temperature will prevent the burns or chilling. So next, I will place a wet washcloth to my patient's forehead, both of her axilla and her groin. And I will ensure that it is properly squeezed to avoid dripping. So these areas will help to reduce the temperature quickly and gently. So ma'am, I will place a wet washcloth on your forehead, both of your axilla and groin. So is that okay?
Yes.
So let me know if you feel any if you feel uncomfortable, okay?
Okay.
So now I will place the damp washcloth on my patient's forehead. And now I will place it on her axilla. So I will continue this procedure for about 20 to 30 minutes. So assuming that I have already performed this procedure several times, I will be moving to the next step. So now I will sponge the upper and the lower extremities of my patient, her back and also her buttocks. And I will check her temperature every 15 minutes. So ma'am, I will sponge your extremities including also your back and also your abdomen. So I will need you to turn to your side again. So is that okay?
Okay.
So now I will first damp this washcloth and I will create a mint so that I can stroke my patient's upper extremities. So now for her lower extremities, I will begin from her toes up to her knees and knees up to her legs or her thigh. So I will only expose the area that is being damped with the washcloth. So now I will clean the back and the buttocks area of my patient. So I will ask her to turn on her side. So ma'am, I will be turning you on your side. Is that okay?
Yes.
So I will only reveal the areas that will be damp with the washcloth. So now I will change the water and I will reapply clean washcloths to my patient's both axilla and also her groin if needed. So this will maintain the effectiveness and hygiene during the procedure. So I will change my patient's washcloths. First, I will start with her axilla. And lastly, the groin of the patient. So now I will continue this sponge bath until the temperature falls slightly above the normal. So now I will check my patient's temperature again and I will record it. But first I have to remove this washcloth under my patient's axilla. Okay, so since my patient's temperature has now improved, I will now discontinue the bath. Now I will dry the patient thoroughly using the remaining dry washcloths to prevent the chilling and promotes comfort. So I will dry the patient using a damping motion over the areas that I have sponged earlier. So now I will cover the patient with a light blanket to maintain warmth without overheating. So ma'am, I will be covering you with a light blanket to keep you warm. Is that okay?
Yes.
So ma'am, can you please hold the top part? So now I will lower the bed to a safe height to ensure the safety of the patient when she moves or sits up. So I have already lowered the side rails for you to ensure your safety, ma'am.
Thank
Okay, so last step is to remove the gloves and to perform hand hygiene. So this will prevent contamination after the procedure. So now for the evaluation is to return the equipment to storage, clean area, and change linens as necessary. Record the time procedure that was started, when it ended, vital signs, and also the patient's response. So this is to ensure proper documentation and communication among the health team members. So this will conclude my return demonstration. Thank you, ma'am.